Russia says that they've now approved a new coronavirus vaccine. Of course, as that worldwide case count tops 20 million. So for more on the coronavirus, both abroad and here at home, I want to bring on Dr. Adrian Burrows, a family medicine physician and CEO of the CFP Physicians Group. Dr. Burrows, we got this news about the new vaccine out of Russia. Seems fast. They haven't completed this phase 3. Yet, how skeptical are you about their timeline, the safety of this vaccine, or any positive news that we've gotten there?
Very skeptical. The reality is that COVID-19 now, the vaccine is an arms race. Everyone wants to be first to market. Russia has developed a vaccine, and they're releasing it before phase 3 has even started. Phase 3 trials is when we see if the vaccine actually works. We see if it has safety. They haven't done any of that, and they're releasing it because they want to be first to market.
All right. Well, leaving that skepticism aside, what does this news mean, for the world, at least in the global coronavirus fight? I mean, is there still room for some optimism here that we might have a vaccine, even if it's coming out of Russia?
So there's going to be a vaccine, before the year's end. Russia, of course, like we just talked about, has made one. The Moderna, America is making one as well with AstraZeneca. So I'm very optimistic that there will be a vaccine. And so yes, I do have some optimism regarding that. I just don't feel like this particular vaccine is one that we should get too excited about because we don't know the safety or efficacy of it.
So if let's bring it back stateside, obviously you're talking about more globally. Dr. Fauci had said that even under the best projections of a coronavirus vaccine, that most Americans won't be able to get access to that vaccine until well into 2021, of course, because the vaccine is going to go first to first responders or the people that are most at risk. So then, if most Americans won't be able to get the vaccine until well into next year, does that mean that we're not going to be able to get the coronavirus under control until then? Because it seems as if everyone is saying that this fight against the pandemic really hinges on most folks getting access to the vaccine.
So again, if we're looking for optimism, I do believe that what Dr. Fauci is saying is correct, that it'll be probably until the middle of next year before most Americans are vaccinated. That being said, I anticipate towards the end of this year, beginning of early next year, you'll start to see a lot of vaccinations. Healthcare workers will go first. The vulnerable elderly and people who have chronic conditions will probably be right in that first wave. And once you have those people protected, I think you're going to see significant decline in the rates of COVID-19.
All right. And in Florida, the state reported another single highest batch of coronavirus deaths. So that's the bad news. But the state continues to decline in positive case totals. And this is a trend that we are actually seeing across the U.S. as the new deaths continue to tick upward, but the positive case numbers continue to trend downward. Is it too soon to view what's happening in Florida or perhaps even across the country as a sort of a positive sign or a fight against the virus? You don't have to give me optimism.
And I'm a realist, and so the reality is that I do take some positivity in the fact that Florida, which has led the nation in COVID-19 cases, is now starting to see a decline in that. We have had a peak in hospitalizations, which happened over the weekend. And it's hard because as soon as you start telling people that, the cases are going down, then they start doing silly things like stopping the social distancing, right? So as long as we keep doing what we're doing, I feel optimistic that we are making some headway.
So speaking about those doing silly things, Governor DeSantis has rejected the plan from Tampa schools to essentially hold all classes online only just for the first month of the fall semester. Obviously, the number of positive cases continues to trend downward, but still, Florida is a hot spot right now. I mean, is that the right call? What are, politicians or government officials getting wrong in this fight against the virus?
Yeah, so it seems that Governor DeSantis had a plan, and regardless of what information he has decided he wants to go forward with that plan. The reality is on July the 9th, there were 16,000 kids in Florida under the age of 17 with COVID. On August the 9th, there were 40,000. So that was a significant increase in children acquiring COVID-19. If we were acting based on data, then certainly we would not be pushing for school reopening. But again, I feel like the governor has enacted a plan, and regardless of the data, he has elected that he wants to go forward with that. And I do not agree with that decision.
All right, we'll have to leave that there. Clearly a lot of politicization of this virus. Dr. Adrian Burrows, family medicine physician and CEO of the CFP Physicians Group. Thanks for joining us.
Thank you.